Another day, another story. Discover the top 10 effective OTC medicines for dry cough. First aid by. Dry coughs can be irritating and uncomfortable, but luckily, there is a variety of over-the-counter, OTC, medication options available to help alleviate the symptoms. This video will provide information about OTC medications for dry coughs, including how they work and what to look for when choosing the right one. We will also explore potential side effects and precautions to consider before taking these medications. Finally, we will discuss when to seek medical attention if a dry cough persists. Dextromethorphan, DM. OTC dextromethorphan, DM, is a very common OTC medicine used to treat dry coughs. It is an antitussive medication, which means it works to suppress the cough reflex and reduce the severity of coughing. DM works by blocking the cough reflex in the brain, and it is usually taken in the form of syrup or tablets. It is typically used for short-term relief of dry coughs, and it should not be used for chronic coughing or for other kinds of coughs such as wet or productive coughs. It is important to note that DM should not be taken with other cough medicines or with alcohol, as it may cause serious side effects. Additionally, always check with your healthcare provider before taking any OTC medication. Guaifenesin. Over-the-counter, OTC, medicines such as guaifenesin can help to relieve dry coughs. Guaifenesin is an expectorant that helps break up chest congestion and makes it easier to cough up mucus so you can breathe easier. Guaifenesin is available in many forms such as tablets, liquids, and syrups, and can be found at most pharmacies. It is important to read the label carefully and follow the directions closely to ensure that you are taking the proper dosage and not exceeding the recommended amount. Be sure to talk to a doctor if your dry cough persists or worsens. Benzonatate is an over-the-counter, OTC, medicine used to treat dry coughs. It works by numbing the nerves in your throat and lungs, stopping the cough reflex. It is typically taken twice daily and should not be taken for more than 7 days. Benzonatate can be taken with or without food and is available in capsule and liquid forms. Common side effects of benzonatate include dizziness, nausea, and headache. It is important to speak to a doctor before taking benzonatate if you have any other medical conditions. Bromhexine. OTC medicine like bromhexine is an effective and safe option for treating a dry cough. It works by thinning the mucus in the lungs and helping it to be expelled more easily. Bromhexine is a mucolytic agent, which means it helps break down and expel mucus from the lungs. It is available in both liquid and tablet form, so it can be taken as a syrup or a pill. It is also available and is combined with other medicines, such as a cough suppressant or an anti-inflammatory. When taken on a regular basis, bromhexine can help reduce the severity and frequency of dry coughs. It is important to take these medicine as directed by your doctor and to follow the instructions on the label carefully. Phenylephrine. OTC medicines such as phenylephrine are commonly used to treat dry coughs. It works by narrowing blood vessels in the nasal passages, which helps to reduce the amount of mucus produced. Phenylephrine can also reduce the amount of mucus in the lungs, which is why it is often used to treat dry coughs. This medication is generally safe and effective when taken as directed and is available in both pill and liquid form. It is important to note that phenylephrine can interact with other medications and should not be taken if you are pregnant or breastfeeding. Levocetirizine. OTC medicines for dry cough such as levocetirizine can be an effective way to reduce symptoms of a dry cough. Levocetirizine is a second-generation antihistamine that works by blocking the action of histamine, a chemical that causes the symptoms of allergies. It also helps reduce inflammation in the upper respiratory tract, which can help reduce the severity of a dry cough. It is generally well tolerated and can be taken once daily to help relieve dry cough symptoms. Talk to your healthcare provider to determine if levocetirizine is right for you. Naproxen. OTC naproxen products are a popular, over-the-counter medication for treating dry cough. Naproxen belongs to a class of drugs known as non-steroidal anti-inflammatory drugs, NSAIDs. It works by reducing the production of certain chemicals in the body that causes inflammation, pain, and fever. It may also help reduce mucus production, making it easier to clear the airways and get relief from a dry cough. Naproxen is generally taken as a tablet or capsule, but it can also be taken as a liquid or extended-release tablet. It is important to take the proper dosage as directed by your doctor or pharmacist. Common side effects of naproxen include stomach upset, heartburn, constipation, headache, and dizziness. Chlorpheniramine. OTC medicines for dry cough such as chlorpheniramine can be a great way to quickly relieve the symptoms of a dry cough. Chlorpheniramine is an antihistamine that works to reduce the production of histamine in the body, which is responsible for the inflammation and irritation that cause dry coughs. It also works as a decongestant to reduce congestion and can help to relieve the discomfort and inflammation that result from a dry cough. Chlorpheniramine is available in a variety of forms, including tablets, capsules, liquids, and syrups, so it can be easily incorporated into an over-the-counter cough remedy regimen. It is important to always follow the directions of the package insert when using chlorpheniramine, as it can interact with other medications and cause side effects. Diphenhydramine. Diphenhydramine is an over-the-counter, OTC, medicine used to treat dry coughs. It is an antihistamine that works by blocking certain natural substances, histamines, that can cause an allergic reaction. It also has a drying effect, which can help reduce the production of mucus associated with some coughs. Diphenhydramine is generally well tolerated and available in several forms, including tablets, capsules, liquids, and topical creams. Common side effects include drowsiness, dry mouth, and dizziness. It is important to follow dosing instructions carefully and to speak with a healthcare provider if side effects become bothersome or if symptoms persist. Pseudoephedrine. OTC medicines containing pseudoephedrine are a common treatment option for dry cough. Pseudoephedrine is a decongestant that helps to reduce the swell of the nasal passages and make breathing easier. It can also help to reduce the irritation in the throat that often accompanies a dry cough. Common side effects of pseudoephedrine include headache, insomnia, nausea, and dizziness. It is important to follow the instructions on the package and not take more than the recommended dosage. It is also important to speak to a doctor before taking any OTC medication, as it may interact with other medications or existing health conditions. Conclusion. In conclusion, OTC medicines can be effective in treating a dry cough. However, it is important to speak to a medical professional before taking any medication to ensure that it is the right choice for you and will not interact with any existing conditions or medications. Taking the correct dosage and frequency of the prescribed medication is also key to get the best results. Thanks for watching.